Hello everyone. Thank you for allowing me to talk a little bit about the Northwest LHIN Leadership Awards. My name is Gil Labine. I am chair of the board for the Northwest LHIN. The Northwest LHIN Leadership Award is now in its 4th year. It was introduced as part of the Northwest LHIN's 10-year anniversary celebration as a way for the LHIN to acknowledge the important work being done by our health sector partners. The Leadership Award is an opportunity for the Northwest LHIN Board of Directors to showcase the achievements of individuals, teams, and organizations who strive to make sure the people of Northwestern Ontario have access to the best care possible, not only now, but also in the future. The 5 award categories recognize the importance of leadership in a variety of areas, including partnership and collaboration, engagement, diversity and inclusion, and value creation. It's because of the outstanding contributions of these award winners that healthcare transformation in Northwestern Ontario advances steadily with innovation, creativity, and collaboration. This award is as much about inspiring others within our region and beyond to follow the lead of the honorees as it is about celebrating their exemplary achievements. We look for individuals, teams, or organizations that were able to demonstrate exceptional leadership and contributions to health system transformation and integration. We had a keen eye for nominees that demonstrated efficiency, effectiveness, and performance excellence. While many programs are on track for incredibly exceptional work, we look for nominees that had proven and measurable success. With so many nominees and high expectations, the selection process was not easy. I would like to congratulate the award winners for their exceptional and inspiring contributions to the healthcare system. But I'd also like to congratulate all those who have received a certificate of recognition for their contributions to the healthcare system in Northwestern Ontario. Your achievements are proof that hard work, dedication, and innovation drive success and make for exceptional programs that lead health system transformation. On behalf of the Northwest LHIN Board of Directors, we thank you from the bottom of our hearts.
Hello, my name is Rhonda Cocker-Ellicott and I am the CEO of the Northwest LHIN. We are always looking to better the care experience, transform the system, integrate and collaborate to create greater value and improve the overall healthcare system. Strong leadership that is transformative and supports and encourages such innovation and change is critical to our collective success. As a result, we would like to recognize and support these leaders and teams that have inspired such change, pushed the boundaries, and created opportunities to better the care experience for patients across Northwestern Ontario. Thank you for your continued commitment to the provision of high-quality care for the people of Northwestern Ontario. We appreciate your continued efforts to change, adapt, innovate, and transform to strengthen our healthcare system. As we look forward into the new year, I encourage you all to continue to strive for excellence as we work together in partnership with patients and families at the center to strengthen our healthcare system.
My name is Jocelyn Bourgoin. I'm the President and CEO of Santé Manitowoc Health, and we're a fully integrated healthcare organization that serves the residents of Manitowoc. I think what's special about this award for me is that it was nominated by the staff. I had no idea that this happened until I received the letter from the LHIN. Caught me off guard, to be honest with you. I thought it was a reminder to submit nominations. So it's very much appreciated that staff have noticed the effort that has gone and the time commitment that has gone into transforming the service delivery in Manitowoc, and that they're supportive and appreciate that it happened. So that's what this award represents for me. Well, I think it's really important that we place the patient at the center or the client at the center of the process. So when we're looking at issues and problems and services, we focus on what's available resource-wise in our community and how can we bring all these resources together for the benefit of the patient. And it's sometimes it's not easy, obviously, and sometimes it's easier than other times. But one advantage small communities have, they have very limited resources. And with the lack of services and the lack of availability of support, then it's sometimes a lot easier to get things done simply because there's no alternative. There's no choice but to work together and to find ways of making it happen. So we promote our collaboration and our partnership simply by driving the need and driving the focus on quality of services to our clients, and really not paying a whole lot of attention to artificial barriers and policies and limitations from programs, and just looking what's here, what can we do with it, and making the best of what we have. I think the biggest impact in our transformation has been for the clients and for the patients. It's created an environment where you have simpler pathways to navigate, where I call it, it's reduced the amount of tag you're at, where in healthcare, one practitioner refers to another, and then that one refers back to another, and then reports to another. And you know, if you look at clinical pathways, sometimes you find there's like dozens of people, but in our system, it's a lot simpler. Is, you know, even if a physician refers to a dietitian, well, it's all within the same structure. It's the same people that control the paper flow. It's the same phone number. It's the same place where you register for both. It's the same EMR system. It's the same, you know, committee meetings. Everything is integrated that way. So when you look at it, it unleashes the potential of what can be accomplished with a multidisciplinary team looking at the clients. Examples of that now is our metabolic clinic, which is now celebrating 1 year in operation. Huge success. We're now looking into the complex care clinic and the memory clinic. And all of these clinics can't happen under silos. And the ability for us to bring all the players together under one roof, one structure, one organization is now benefiting the patients in ways we couldn't even imagine a few years ago.
I'm Heidi West, the Executive Director of the Mary Berglund Community Health Centre Hub in Ignace, Ontario. So community well-being where everyone matters really is a grassroots approach to care and services in the community of Ignace. It's a model of care that looks at the person as a whole. It's holistic. It's not just primary care, it's about the community and the variety of initiatives and health and wellness programs we provide in addition to the primary care piece. And it's putting the client at the center, empowering our clients, educating our clients, and allowing them to make the best possible life choices and health choices that they can. Some of the goals of the program really is to work in collaboration with clients, families, our community, and other service providers that aren't technically health related. We reduce barriers related to access, health equity, health literacy issues, those types of things. Provide primary care, health promotion, which has reduced the amount of ER visits in our community. Really grounded in a community development approach through the addition of a community food bank, community garden, clothing exchange program, and a variety of education and empowerment type of care and services throughout the community. So the objectives of the model of care really is to give each person in the community of Ignace the best quality of life possible. We do this through our primary care and program team, working in collaboration with our clients, families, caregivers, and our community as a whole, as well as other service providers. We develop coordinated client care services to truly provide a holistic and individual support for each person that we see. So the Mary Berglund Health Center has shown significant improvements in all of our quality indicators as well as overall client satisfaction. We've also been able to institute same-day appointments for our clients this year. We have about 467 clients that stated to us in the last 12 months that they avoided an ER visit by the care and services that our team at Mary Berglund offered. The initiative as a whole has demonstrated a higher sense of belonging in our community and instilled trust in the healthcare system as a whole. I believe the community of big names and the team at Mary Berglund's exceptionally proud of the health center that we have. And for a small community that's faced with many struggles and social barriers, it's really the heart of the community, and we're extremely proud of that.
My name is Tracy Smith. I'm Senior Director of Communications and Engagement for Thunder Bay Regional Health Sciences Centre. Our organization has really progressed in terms of its commitment to advancing and enhancing French language services at the hospital. All of the activity that we're doing is really guided by our Francophone Advisory Committee. These are members of the community who help to identify our priorities, contribute to specific initiatives. And over the past little while, a number of those initiatives are having a significant impact. We are moving towards active offer of French language services. What we've done to support that is, one thing is we have appointed a French language service officer. So Stephanie Ray is a first point of contact. We've also introduced linguistic variable questions at all points of admissions and registration. So this supports patients and family members to identify what their mother tongue is and their preference in terms of English or French language. So to support that, we've provided resources to our staff, all staff across the organization, so that when someone does identify that they prefer French language services, we can connect them either with staff internally who speak French. We can support them by connecting them to community services. And again, our French language services officer can provide that support. So we've also done a lot of work in terms of enhancing the bilingual content on our website. Anyone walking through our organization throughout the hospital will notice that signage in bilingual format has increased a great deal. We've also implemented processes so that all new and revised patient education materials are automatically prepared in a bilingual format. So presenting the materials in bilingual format means that people don't even have to ask for the same information in French. It's right there for them already in French. And another piece that we have implemented that I think is having a really significant difference is we have added a couple of sentences in the French language to all of our outpatient appointment letters. And that sentence in French invites the recipient to contact our organization, our French language services officer, if they prefer to have the information in French. And it also guides them so that they can make contact if they want an interpreter at their appointment. We've received a number of phone calls already and had tremendous success stories as a result of that. So we're really proud of the work that we're doing. I think that this recognition validates that we're on the right track, and it certainly motivates us to keep going.
Hello, I am Anita Jean. I am a patient family advisor and a member of the Francophone Advisory Committee at the Thunder Bay Regional Health Sciences Centre. The work of the Francophone Advisory Committee is commendable because over the few years that I've been involved in that committee, despite the fact that there's a small number of Francophones in the community of Thunder Bay, the work continues. There's ongoing progress. there's more material that's being translated, and it really has an impact on health outcomes of francophones. Imagine that you are, first of all, there's a literacy issue. Approximately 60% of folks in Thunder Bay, 17 region, have a lower level of literacy. They would have a difficult time figuring how much medication, cold medication to give a child based on their weight. So first of all, that health literacy, and then secondly, it's not in the language that they normally speak. How can you take care of yourself? How can you improve your health? How can you follow the recommendations from the healthcare provider if you don't really understand? You might not do the most to make sure that you stay well, that you don't come back to emerge, you're not taking your medication properly. So if you that you're calling in to confirm an appointment, that you're following the recommendations in terms of not eating, not drinking before surgery, things like that. So there's a definite improvement or better outcome by having material in French.
Yeah, I'm Karen Stevenson. I'm the Executive Director of the Thunderbird Friendship Center here in Geraldton and the Thunderbird Child and Family Center in Long Lake that has just started in June.
And I'm Lucy Bonanno, and I am the Chief Executive Officer at Geraldton District Hospital.
The program that we developed is called Never Forgotten, and it's just something that our staff have always done, but we've never actually had a memorandum of understanding between the Friendship Center and the hospital. When Lucy contacted me, we got together and started talking, and she asked me to help with the Indigenous culture, to bring some of it into the hospital for the residents, and so we got talking, and I said, well, it's a good idea. And we have a new program called Cultural Resources. That's Raquel Kashkish. And prior to that, it was Cheryl Checkley and Angie Ice who've been bringing things over like Tai Chi to the residents of the hospital. And my thoughts were that these residents come into the hospital, and some are forgotten by their families for one reason or another, or friends, and because they're now in a place that they just don't have the freedom they did at home. And I got to thinking that years ago, you have to understand that most of these people, many of them volunteered their time, their effort to the community. They gave a lot of themselves, and now they can't. We don't want them to think that the community has forgotten them. So we wanted to bring something in for them. So we kind of asked Lucy what it was that they would like to see. And she kind of mentioned just, visitations, crafts, bannock making even, for those who could. So we said, yeah, we could provide that with, no cost to the hospital. It's something that we feel privileged in doing for our seniors. And it's not just for the Aboriginal community members, it's for all of them.
In terms of health outcomes, I would say that it's helped to improve their mental state. It's really helped to make them feel that they're not forgotten, and that, oh wow, there's something I remember as a child when I was growing up. So I think their mental health has improved. Even things like medication compliance has improved, I would say, as well as communication. They're more willing now to come out of their room. It helps to lift their depression, to come out of their room and want to be there for that afternoon of arts and crafts specifically related to that day, to that Indigenous time slot. Because we have various programs. This is one of them for our residents. But I believe it's going to grow even more. Karen and I have even talked about that. I think in time it's even going to grow bigger and more. And I think right now it's actually one of the most popular programs we have for our residents in long-term care.